Just want to first welcome you to YTI Career Institute. It's wonderful to have you join us today. If you're a little nervous about your future and uncertain about this webinar, I want to set your mind at ease knowing that this will be a fun and enlightening time for you. My name is Mark Johnson, and I'm a career program specialist for our school. And I work with people who are seeking employment, who are looking for a career change, or just want advancement in their current professions. Our programs aren't just for recent high school graduates. Many of our students are career changers seeking better opportunities so that they can have a better future. If you or someone that you know are eager to make a career change, don't keep putting it off. I encourage you to apply today and make the change so that 2022 can be a bright year for you. YTI Career Institute has campuses in Lancaster, York, and Altoona, Pennsylvania. We offer programs in business, computers, culinary and skilled trades, and in healthcare. Today, I'd like to introduce you to Ms. Carolyn Eberly, our program director for the Medical Billing and Coding program, as well as for our Health Information Management program. Both are taught entirely online from our Lancaster, Pennsylvania campus. She'll be here to share with you all the program details. We'll discuss the enrollment process, and we'll have a time for questions and answers at the end. So we're excited to help you on this new career path. Here's Ms. Eberly.
Thank you, Mark. Welcome, everyone. We're so happy you could join us today. So we're going to talk about the two programs. We're going to compare and contrast the differences between the two. So we're going to go ahead and get started. First of all, let's talk about what the similarities are between the two programs. Both programs focus on the business, administrative, and the office side of the medical profession. Both programs have instructors who have actually worked in the field. Some of them are still working in the field. So you benefit from their real world knowledge, and they're able to share their experiences with you in the classroom. And again, both are 100% online training. So let's talk about the differences between the two programs. The Medical Billing and Coding program is a specialty within the field of health information management. The Medical Billing and Coding concentrates on medical billing and medical coding tasks, such as assigning codes so that payers can be reimbursed. And they also work on registration issues to get patients registered into the hospital. A health information management program student will also experience not only the coding and the billing, but they will also learn about the technology, the legal aspects, and the management and data analysis of health information. Medical billing and coding graduates earn a certificate or a diploma, and the health information management graduates earn an associate and specialized technology degree. So let's start by just talking about health information management for a couple minutes, and then we'll segue into the medical billing and coding program. Oh, I'm getting a little ahead of myself. Okay, the program overview for health information management. First of all, it's a 20-month program that consists of 8 10-week terms. The program offers a capstone course wherein your final term, you'll complete a 60-hour professional practice experience with a professional mentor from a medical facility. The program is accredited by the Commission on Accreditation for Health Informatics and Information Management Education. Many people have only heard of this as CAHIM, which is the acronym for their name. Graduates from this program can sit for the Registered Health Information Technician Certification exam. We do have a prep class to help students prepare to take that certification exam upon graduation. The courses are delivered asynchronously through the online without live instruction. So let's talk a little bit about what that means. Learners will log in at their convenience and have access to their course materials 24 hours per day through our school's learning management system, which we use Canvas. The faculty are available for assistance. They have regular online office hours, but you can email them, and you can also attend the coding clinics that we offer to assist students with any issues they may have. Students will have weekly due dates on their module assignments as well. The synchronous sessions may be scheduled, such as for a guest speaker, or maybe an instructor is finding that students are struggling with a concept and he or she decides they're going to hold a real-time meeting, which is fine. It will be recorded. So if you can't attend at that particular time, you can always go back and watch the recording. So you always have access to everything, whether you can attend it in real time or not. Our online health information management program combines qualified instruction and student support with the independence and the flexibility of online learning. You can learn diagnostic and procedural coding, reimbursement and revenue cycle management. You will learn how to use electronic health records. You'll take a course in medical law and ethics. You'll learn how to manage and manipulate health data into reports. We talk a lot about communications, both medical and financial and personal. And you'll also learn how to do healthcare statistics and report those to state agencies. Some of the courses in the health information management program include anatomy and physiology, medical terminology, pathophysiology, health information systems, a pharmacology course. You'll have several courses in coding. You'll have a healthcare statistics course. You'll have a legal course. You'll have a CPT and HCPCS coding course. And you also have a professional development course. One unique thing about our program is that we offer students the choice of a specialization. You can either choose a revenue cycle specialization or a data analytics specialization at the end of the program. This will be taken in your last term. So each student takes the same courses in terms 1 through 6. And then in your 7th term, you are going to decide which specialization you're interested in. So in term 8, you can sit in that specialization course. So in the revenue cycle specialization, you will look at the financial management processes. You'll look at learning how to comply with regulatory requirements. You'll learn how to do case mix and case mix index as well. All of this has to do with the business end of bringing money into the organization. In the data analytics specialization course, you will learn how to look at all the data characteristics. You'll run data analysis reports. You'll look at trending of data. You'll learn different techniques on how to look at data and how to make them usable to the providers in which we serve. You'll also learn about the standards for the exchange of health information, and you'll actually have a couple activities where you'll go in and learn how to run reports and make sense of what the data is that you see. So these are very exciting specializations right now that providers are asking for. So we decided to offer both of these so students have a choice when they come to YTI. Some advantages of an online program include flexibility of personal and work schedules, self-paced control of content learning. And what that means is you're not sitting in a classroom having to do what the teacher has planned for that day. You have the whole week to look at what is expected of you, and you can fit that into the time that works best for you to absorb that material and to be able to use it. You'll also have the opportunity to learn new and future virtual essential communication workplace technical skills. We are moving to a virtual world in this type of health field where a lot of the people are working from home now. People aren't going to work. They're staying at home and they're working in their home offices. There's a unique skill set that goes with that, such as learning how to work through webinars and conference calls and learning how to present yourself well on camera. So we have built a lot of those new activities into our courses so students are comfortable with that when they graduate. And another unique thing about working in an online program is that you get to create your own personal workspace to maximize your learning style. When you're in a classroom, you're pretty much sitting at an assigned seat doing what the instructor tells you to, and that might not fit your learning style. Some people do better when they're surrounded by a lot of natural light. Other people like to work in a small confined space so that they can focus. So whatever works best for you, you have the ability to build that now as a virtual student. In this program, actually in both programs, you have to keep a 70% or higher in your courses to pass. You must maintain that 2.0 GPA to graduate from the program. If you're struggling in a class, you need to ask for help early, and we're here to help you and want to see you succeed. As I said earlier, once you graduate from Health Information Management, you can sit for a certification exam. And again, that certification is the Registered Health Information Technician. What you see on your screen is actually what that RHIT credential looks like that you can assign after your signature line once you are certified. I hold this certification myself. So you might be asking where you can work when you have this degree. Well, most of the RHITs work in hospitals, but we are also branching out into other healthcare settings, such as physician practices, nursing home health agencies, mental health agencies, and public health agencies. We're starting to see a lot of our people go to work at pharmaceutical companies, working for lawyers and insurance firms and health product vendors. One thing that I forgot to put on the slide that I do want to mention is the corrections aspect of health information. I worked in a state prison for almost a year. I didn't make it quite a year, but there is a need for health information management career people in the prison system because they have health care as well. So if you think that's something that would be interesting to you, there's always job openings at the prison in this field. Some of the things that an RHIT does is ensure the quality of medical and health records by verifying that they're complete, accurate, and that they have properly been entered into the computer systems that your healthcare provider uses. We must learn how to use computer applications to assemble and analyze patient data for the purpose of improving patient care and controlling cost of healthcare. We often specialize in coding diagnoses and procedures in patient records for reimbursement and research. Research is another role where we're starting to see a need for our career people to grow, especially with COVID. There's a lot of COVID research, and a lot of my students in programs where I've taught have been tapped to go into research and help with that data. An additional role for an RHIT is also a cancer registrar. We're in need of cancer registrars across the country. Each state has a cancer registry that is run in the state capital that compiles and maintains data on all cancer patients. So just so you know, some of the advancement opportunities that can be afforded to you include the move into entry-level management positions, the ability to continue your education so you can advance into a director position. A lot of companies will hire you on as an entry-level position, and once you've proven yourself to be a valuable employee, they may offer to pay for you to go back to school so you can go into management. And this happens to at least, half the people I know. This is what's happened to them. So it is very important that you keep your mind open to always continue to learn. You also want to remember that this education provides graduates with an overview of each aspect of health information management, which allows graduates to change their focus without needing to go back for another degree. I always like to tell people what I loved about my degree is that when I got bored and I wanted to do something different, I could go do that without having to go back and get more schooling. So this degree is wonderful for that. If you're a person that gets bored easily and doesn't like doing the same thing, this allows you to do several things within one degree. Now we're going to talk about the accreditation for our school. YTI Career Institute is accredited by the Accrediting Commission of Career Schools and Colleges, also known as ACCSC. Next, we're going to talk about the Medical Billing and Coding Program. As I said earlier, this is a 12-month program. We do prepare you to take the Certified Professional Coder exam. It's administered by the American Academy of Professional Coders, AAPC, or you can sit for other coding certification exams that you may find on the internet that you would rather sit for. But we do pay for you to take the American Academy of Professional Coder certification exam. We do pay for the RHIT exam for our health information management students as well. This program is also delivered online, where the students will have weekly due dates without live instruction. There are synchronous sessions that could be scheduled, such as a guest speaker, or someone might interview someone else so that you can maybe hear firsthand experience about someone with a condition that you might be coding. We have an instructor who does that often. He always invites you at the time he's going to interview, but he also records it so that you can always go back and watch it later. Again, we do combine qualified instruction and student support with the independence and flexibility of online learning. Within this program, you will learn how to create medical records, how to schedule patients. You're going to have an anatomy and physiology course. Actually, you're going to have several. You're going to learn to code in both CPT and ICD-10 format. We have a PCS course that we teach you as well. We teach you how to manage insurance claims, and we teach you how to have good management skills as far as finances are concerned, because that's very important. If you want to be hired as a biller or a coder, you must have good fiscal management skills. So we do touch on that in our program as well. Some of the courses you'll find in the Medical Billing and Coding Certificate Program include anatomy and medical terminology, CPT coding, coding and classification systems, medical office administration, career development, reimbursement methods, PCS coding, and medical billing and coding simulation course. And that's your capstone course at the end of the program. This course does not offer any time out like on an externship. This is all done within your home on the computer with simulated activity. Again, some of the advantages of taking the online program are the flexibility of schedules, self-paced control of your learning, the opportunity to learn those essential communication workplace skills, and again, being able to design your personal workspace to maximize your learning style. This program, like the HIM, says you must maintain a 70% or higher in each course. You must maintain the 2.0 overall GPA to graduate from the program. And again, we do remind all students that if you struggle in a class, you should ask for help early. We're here to help, and we want you all to succeed. We do have a certification prep course in your third term, and we prepare you to take the CPC exam. And again, that's an online exam that you will schedule and take at home. They have a proctor that they assign to watch you via a camera that you'll sit and take the online certification exam. It's 2 hours and 45 minutes in 2 parts. So it's a long exam, but at least they allow you to break it up, that you'll do 2.5 hours in one session and 2 hours and 45 minutes, I think, in the second. So it is broken up for you, that you're not sitting and doing all the 5 hours at one time. Some of the career opportunities, if you sit for the MBC program, you could go work in a physician's office or a nursing home. You can work in any office type setting, such as a chiropractor, an optometrist, or a podiatrist. Some insurance companies are interested in our billing students, and billing agencies that actually outsource and do billing for private physicians will hire our students as well, as long as you're certified. You want to sit for that certification exam. So advancement opportunities with the certificate would be gaining experience, meaning working as a coder for 3 to 5 years. That will allow you to move into other coding positions or supervisor positions. And also adding other certifications will assist you to advance in your career as well. They have a certified inpatient coder certification you could sit for as well, certified outpatient coder, a risk adjustment coder, and a specialty coder. We have several students who go on and want to concentrate in just one area, such as cardiac or obstetrics, where they just concentrate on that type of coding, and they go get certified in that specialty. Again, our school is accredited by the Accrediting Commission of Career Schools and Colleges, ACCSC. And Mark, we're going to throw it back to you to work on the question and answer period.
All right. Well, thank you so much. That was really great. And I think, you know, a lot of you out there that have joined us probably have a ton of questions. I also want to add that we have a number of resources to help you be successful in this program, along with Career Services Office that'll assist with employment, what you're done, and so on. So before we get to questions and answers, I want to briefly explain the admissions and enrollment process. So first, you'll need to create an application through your student portal at admissions.yti.edu. This link can be found on our website or in your most recent email from us. From there, our automated process will walk you through a brief assessment, allow for you to upload a copy of your proof of high school graduation, which can mean a photograph of your high school diploma, high school transcripts, or your GED. And the portal will also walk you through the student funding process, which includes how to apply for financial aid. Now, many students take advantage of federal funding through the FAFSA. So our website has this link along with information about state aid, scholarships, and so on. And we're here to help you along the way. And to make it easy for you to apply, we've waived the application fee. So there's no cost to apply for this program. And as I'd mentioned, if you need help through this process, myself or another career program specialist will be here to help you. So now for questions, feel free to type your questions in the chat box, and I'll do my best to field those for you, as well as Ms. Eberly. So one of the questions here is, how much is the program? I know that's one of the big concerns that many students have, is how am I going to be able to afford school? That information can be found on the website, but just since you're asking right now, for our medical billing and coding program, that cost is $20,550, and the health information management program is $31,682. And again, that information will be found on our website. We can send you more information on that, as well as how many students take advantage of different types of funding options through the FAFSA, as I mentioned, state aid and additional scholarships to help you manage and cover the cost of your schooling. One of our student funding specialists will help you with that as well. Great question.
Mark, I want to remind everyone that's on the call that your certification exams are covered in that tuition. So you don't have to go out and pay for those after graduation. That's part of your tuition. So that's pretty unique that a school does that. And that's really a good point to really hit home on, is that you're not coming up with money extra for that. That's part of your tuition.
Absolutely. Everything to be successful in this program and beyond is all included in that cost, all the resources, books, laptop supplies, and so on.
While we're waiting on questions, I will share that some of the background of the faculty in the program include hospital settings. We have people that have been office managers. We have people that have worked as coders for years. I have one instructor who just got a promotion to director of coding for her whole organization. I have one adjunct who is actually a coding auditor at a local hospital. We have another adjunct whose background has been military. So that's unique to have that military program background to bring in classroom. Like I said, I have a background in corrections and long-term care. I have another faculty member who actually lives in Florida, and her background is in the electronics part, in the computer aspect. So she brings a unique skill set as well. So we do have varied backgrounds in the classroom. So you're not going to be cheated out of an experience of any type of healthcare. We've been around. We have quite an array of experiences to offer.
Thank you. A question that I often get asked is, will these credentials only be utilized here in Pennsylvania, or can I move? Will they be recognized elsewhere? Can you help me answer that, Ms. Eberly?
Sure. Both of these credentials are nationwide. You can move anywhere and not have to update your license or your credential. It will carry with you across the whole nation, which is really nice as well, because there are a lot of careers that you have to be licensed in each state. And that is not true in medical billing and coding or health information management.
Thank you.
Mm-hmm.
Another question that I often get asked is, how much time will I be spending in class each day or each week?
Good question. I was just going to bring that up myself. Students that enter our program should plan to spend anywhere from 20 to 30 hours a week on schoolwork. That includes doing the reading assignments, answering discussion questions, taking exams, doing homework, and you take anywhere from 3 to 5, depending on the program. If you're medical billing and coding, you take 3 classes a term. Health information management, you take anywhere from 4 to 5 a term. So it just depends which program you're in, how much time you're going to spend in class.
Thank you. Along those lines, another question that I often get asked is, when should I be doing my schoolwork? What if I work during the day? Can I do my work at night? Or what if I have a night job? Can I do my work in the morning?
Right. I always tell students to try to plan their work or their homework around when they're most alert. If you work night shift and you're tired in the morning, it might be better to go to bed or do something else for a while and wait till another time of the day when you are alert. You want to try to schedule it where your kids aren't going to need you the most. It's very hard to try to babysit and do your homework at the same time. So we do suggest that you try to find options, a couple times a week where someone can take the children and let you focus on schoolwork. So that's important as well. I have some students that like to do all their reading through the work, and then they don't sit down till the weekend to do their actual writing assignments and discussion boards. And, that's fine. You'll find a routine that works for you. I think probably the first week of the term is the most stressful on a student until they find that balance, but it's there. I'm really big on working with the students on creating a calendar to hang on a refrigerator that shows when you're at your job. It shows when your kids have football games you have to go to, and then you actually schedule your study time so the rest of the family knows that's my time, that's your time, that you can't be disturbed, because this is like having another job. This needs the dedication that you would give a job.
Great.
Some of the resources we have available to students at no extra cost include a coding clinic that is run by one of our adjunct instructors. She runs it on Saturday morning and a couple evenings a week around her full-time work schedule, where she works with students that are struggling in their coding courses in real time. She's on Zoom with them. We also have the online library. All the resources through our Learning Resource Center are available anytime to our students. We have a tutoring option that you can reach out to your instructors, that they can work with you outside of their office hours on concepts that you're struggling with. We do have guest speakers that come in and shed light on things that people maybe are struggling with. We have a lot of online resources that we can offer as well. So never feel like you're alone or don't have some place to go. We have plenty of resources to help our students.
Well, I think we've had a great audience join us today. Ms. Eberly, it sounds as though you've done a great job of answering a lot of those questions. We don't have any more questions that are coming in right now. But if anyone that has joined us, you do have future questions, feel free to text them to myself or email us through our website, and we'd be glad to help you through that process as well. And don't hesitate to pass this information along to someone else that you might know who may be looking to get into a new career. Perhaps, it's not a medical career they're looking to get into, but maybe one of our trades or our IT programs, our culinary school, or any number of other opportunities that we have through YTI Career Institute. Thank you so much for joining us today. Ms. Eberly, would you like to have the last word?
Just thank you for your time today, and we look forward to seeing you.
All right. Have a great rest of your week.